Welcome back to Nutrition Mnemonics. Today we are going to be reviewing important lab data that you would see during the nutrition assessment phase. This information is very important for clinical dietetics, and it will surely show up on the RDN exam. As always, I have done my best to come up with silly little stories in order to help us better remember these concepts. They're not just for you, but also they're for me because I have yet to take the RDN exam and I too want to prepare for it. And this is how I would be studying anyway. So we're just gonna do it together. First up, we have sodium. There are many reasons that you may see a sodium abnormality. And of course, we need to keep in mind that as sodium increases in the body, in turn, potassium will decrease and vice versa. The specific condition in which we have an excess of sodium in our body is called hypernatremia. Dehydration is associated with hypernatremia. Hyponatremia is associated with loss of sodium due to diarrhea or vomiting, and then not replacing the lost sodium in the system. Fluid accumulation in the form of edema and ascites is also correlated to that hyponatremia, that low body sodium. Here is our mnemonic. There was a sports team that started chowing down on their favorite snacks. These included pretzels, chips, and fried chicken, which are, of course, all very high in sodium. Unfortunately, they didn't have any water and they got completely dehydrated. It turns out that these snacks were poisoned by their opposing team, which caused intense fluid loss in the form of diarrhea and vomiting. The opposing team was a group of hippos. They couldn't replenish the lost sodium because all the snacks they had were poisonous. In the end, they all had bloated teas and edema on their feet. Anemia is super fun because there are a bunch of different types and ways to understand it. And we are going to be looking at both, of course. When it comes to microcytic anemia, this is going to be indicated by a low mean corpuscular volume. When it comes to macrocytic anemia, we are looking at folate and vitamin B12. It's also worth noting that in macrocytic anemia, homocysteine levels are increased. Here's the mnemonic. A 12-year-old boy made the foolish mistake of showing up to a family picnic late. The picnic was being held at his home. He thought his sister was going to be picking him up, but she never came, so he had to run all the way from school back home to make it in time for the picnic. He was so disoriented when he arrived that he sat on a fresh plate of macaroni and cheese. We will be looking at lipoprotein, of course. HDL levels should not be less than 40. LDL should not be greater than 131. This is a good indication of the level of cholesterol in their system and whether they are at an increased risk of cardiovascular disease. And then, of course, the classic hemoglobin A1C is used to indicate if someone has prediabetes, which would be between 5.7% and 6.5%. And if that HbA1c is greater than 6.5%, we would diagnose that patient with diabetes. Now we have glucose. Glucose is, of course, going to be related to diabetes, but it's also going to be related to an indication of high stress or inflammation in the body. High blood glucose, hyperglycemia, is correlated to diabetes, severe stress in the form of infection, burn, and surgery, while low blood sugar, hypoglycemia, is correlated to a patient dosing themselves with too much insulin when they have diabetes. Next up, we have potassium. When we think potassium, we think hyperkalemia and hypokalemia. Hyperkalemia is associated with renal failure. Hypokalemia is associated with diarrhea, vomiting, and the use of diuretics. The mnemonic for this is DJ Khaled was eating potatoes with his pet possum while undergoing dialysis due to his renal failure. after he came home and tended to his pet hippo who was sick with diarrhea, vomiting, and excessive urination. Moving on to phosphorus. Hyperphosphatemia is associated with renal disease and renal failure. Hypophosphatemia is associated with refeeding syndrome. Now let's talk about BUN. When you see increased levels of BUN in the system, this indicates renal disease, excessive protein catabolism, dehydration, and it may be correlated to a high protein diet or a low protein diet. Decreased BUN is associated with pregnancy and liver failure. A cat is on dialysis and his friend, the bunny, is offering moral support. Cat is dehydrated, so bunny grabs him some water. That is for the increased levels of BUN. Now for the decreased levels of BUN, here's your mnemonic. Liv is pregnant. There is a bun in her oven. Bun in her oven as in baby in her belly. This is her decreased BUN. Creatinine is a lab value that is associated with renal disease, in which case the creatinine levels are increased. And it's also associated with a protein energy malnutrition, in which case the creatinine levels are decreased. Albumin is a great way to understand how severe someone's illness is, and of course the inflammatory stress, and even serves as a way to indicate mortality. Albumin is typically lower in those who have liver disease or acute inflammatory disease, and people with increased levels of albumin are experiencing dehydration. People with decreased levels of albumin are experiencing overhydration, so they're kind of opposite to one another. Okay, so there are some other more obscure lab values that I did not cover in this video. Hopefully we will be okay without those, but the ones that I covered are really, really major when it comes to examining a patient's lab work during the nutrition care process. I really want to pass the RDN exam. It's no secret that fewer and fewer people have been passing it recently. So let's work together. Let's help one another in studying. I highly encourage you to subscribe to my channel if you are in the process of preparing for the RDN exam, if you are a dietetics student, or if you're passionate about nutrition or biochemistry, or if you just want to hook a sister up and help me out and subscribe. These are all great reasons to subscribe and like the video. I am so proud of you for being here. You're doing great. Learning can be hard, but you're doing it. Have a great day. I'm proud of you.